Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. My name is Rheinata Saskya Djohan, and in this time, I would like to present my essay about bullying. Okay, so I would like to start my presentation. Okay, let's start. So I would like to present about bullying. My essay, the title is Causes and Effects of Bullying on Children. So this is the table of contents that I would like to explain. The first is introduction. The second section is causes. The third section is effect, and the fourth is conclusion. Okay, let's move to the first section, that is introduction. So, bullying is defined as a repeated act or behavior that is intended to make a person or group of people feel uncomfortable and to cause harm to the victim verbally, physically, or psychologically. According to the data collected by World Vision Indonesia, there were 1,926 cases of bullying at school in 2008, which increased to 1,891 cases in 2009. This figure continues to rise year after year. Bullying can happen to anyone at any time. Bullying must come in during a child's adolescence. According to previous research, children who receive treatment for bullying at school are more likely to experience psychotic disorders, which are mental disorders characterized by children's inability to accept reality. And this disorder manifests itself when they are 18 years old. Okay, the second is causes. So there are 5 causes of bullying that I want to explain. The first is home situation. Bullying can be a result of a difficult home situation. A child raised in a families with authoritarian child-rearing practices that are harsh and punitive are more likely to bully their peers. The second is intolerance. Prejudice. Intolerance are specific group based on gender, ethnicity, race, religion, or disability contributes to bullying. Minorities in a group will be bullied because they are different from the majority. The third is violent games or movie. It can influence some people's, including children, behavior that can make them more likely to be bullies. And the fourth is children aggressiveness. So the children typically, the aggressiveness children typically want to be in charge of everything, and they expect everyone to conform to their wishes. If things don't go as planned, they'll resort to bully. And the fifth is attention seeking. For some, it may be an attention-seeking behavior, especially if they are not getting enough care and attention at home or elsewhere. Okay, move to the third section, that is effect of bullying on children. So, the impact of bullying is huge. There are several effects of bullying for children. The first is it causes unhappiness and distress. It can even result suicide. For children bullied at school, the effect can last long into adulthood, affecting the rest of their lives. The second is decreased academic achievement. There have been some cross-sectional and longitudinal studies that have provided support for a relation between being bullied and increased risk for poor academic achievement. The third is physical health consequence. The physical health consequence of bullying can be immediate, such as physical injury, or they can involve long-term effects such as headaches, sleep disturbance, or insomnia. And the fourth is mental health consequence. Bullying can cause feeling or rejection, exclusion, isolation, low self-esteem, and some individuals can develop depression and anxiety as a result. Social pain describes the feeling or pain that follow the experience of peer rejection, criticism, or loss. Social pain is consistent with how people describe their feeling about being bullied. Okay, the last is conclusions. Bullying is unacceptable because it has serious and lasting negative impacts, which may result in the victim committing suicide. Bullying prevention works well in schools and other institutions to reduce bullying. Bullying, particularly physical bullying, can lead to absenteeism from school, poor academic achievement, depression, and eventually death. Intervention from preschool years is designed to reduce bullying in all situations. However, bullying prevention can be successful if anti-bullying packages are comprehensive. There is also evidence to suggest that bullying prevention aims to prevent bullying from occurring in the first place. Okay, I think that's all my presentation. Thank you very much for your attention.